Hello, my name is Rebecca Bosa and this is my head to toe assessment video. My video is going to paint the room. Knock knock. Hello.
Hello.
How are you doing today?
Good.
Good. My name is Rebecca and I'm going to be your student nurse today. I'm going to be doing your head to toe assessment. Is that okay?
Yes, ma'am.
Okay, thank you. I'll drape the curtains for your privacy and wash my hands. I'll put the bed up to a working level. Can I see your wrist, please? Name and date of birth.
My name is Elizabeth Wassa, July 2nd, 2016.
Okay, thank you. Do you know where you are?
I'm in my room.
Do you know what is today?
Today's Saturday.
Do you know what I'm going to be doing?
A head to toe assessment.
Okay, thank you so much. As I was talking to my patient, I was also looking at her and observing her. The patient is breathing, is unlabored, and the patient is breathing on room air because there is no any oxygen tubings or masks on her face, on their face, and the skin is appropriate to ethnicity, no cyanosis noted. The lip color is appropriate to ethnicity. The patient is well groomed, the hair is well kept, and the patient is well dressed in clean clothing. The patient is able to communicate appropriately without any issues. Okay, now I'm going to go ahead and assess your back for any skin breakdown. Okay, there is no skin breakdown or any ulcerations on the back. Okay, I'm going to go ahead and look at your ears, and then your nose. There is no drainage from the patient's nose or ears. And I'm going to go ahead and assess your eyes. Okay, can you look at me right here? The pupil size is about 4 right now. They are round and equal on both sides. There is no drainage from the eyes. The sclera is white and the conjunctiva is pink. Okay, I'm going to flash some light in your eyes. Is that okay? Pupils react to light, and they went down to about a 2 on both sides. Okay, can you look up there for me? And then I'll ask you to look at this pen. Okay, can you look at the pen? Patient's eyes can accommodate. Okay, thank you. Now I'm going to assess the patient's jugular veins on the sides of the neck. Okay, can you face that way? And then this way. Patient's jugular veins appear flat. There is no jugular vein distension noted or any abnormal pulsations. Okay, now I'm going to feel for your carotid pulse, which is on the side of your neck. Carotid pulse is 2 plus bilaterally, regular rate and rhythm. Okay, now can you put out your arms for me, please? Okay, you can put them down. The temperature on the upper limbs is warm and the skin is dry. There is no abnormal discolorations or ulcerations noted. And the skin is appropriate to ethnicity. Okay, I'm going to feel for the patient for your brachial pulse, which is located in the inner aspect of your elbows. Brachial pulse is 2 plus bilateral, regular rate and rhythm. Now I'm going to feel for your radial pulse, which is in the inner aspects of your wrist. Radio pulses 2 plus bilateral, regular rate and rhythm. I'm going to check for your skin turgor by just pinching a little bit. The skin was able to return to its original form. There is no skin tenting noted. I'm going to check for your capillary refill. Capillary refill is less than 2 seconds bilaterally. Okay, thank you. Now I'm going to check, look at your left. The temperature on the lower limbs is warm and the skin is dry. The skin color is appropriate to ethnicity. There is no skin breakdown or ulcerations noted. The bony prominences appear with to be in normal condition. Okay, I'm going to check for your pulses. Posterior tibial, 2 plus bilateral, regular rate and rhythm. Dorsalis pedis, 2 plus bilateral, regular rate and rhythm. I'm going to check for your capillary refill. Capillary refill is less than 2 seconds bilateral in the lower limbs. Okay. No edema noted. Now I'm going to check your muscle strength. Can you push down on me? Thank you. And then push up. Okay. Patient's muscle strength in the lower limbs is a 5 plus. Okay, can you push down on me? And then push up. Patient's muscle strength is 5 plus bilaterally in the upper limbs. Okay, I'm going to go ahead and listen to your lungs, okay? There's a lot of spots that I'm going to be listening to, but that doesn't mean anything is wrong with you, okay?
Okay.
Just breathe normally. Patient's lungs are clear on auscultation anteriorly. No adventitious sounds noted. Okay, I'm going to listen at the back.
Okay.
Okay. Patient's lungs sounds are clear. Patient's lungs are clear on auscultation. Posteriorly, no adventitious sounds noted. Okay, now I'm going to go ahead and check the patient's pulse for 1 minute. I'm actually taking the patient's respiration. Patient's respirations is 17 breaths per minute, which falls under the normal range, which is 12 to 20 breaths per minute. Okay, I'm going to change to check your lung expansion. Okay, I'm just going to touch your chest and then I'll ask you. Okay, can you breathe in and then out? Taking a deep breath, then out. Thank you. And then in the back, breathe in, and then out. Thank you. Patient's lungs expanded symmetrically bilaterally. Okay, now can you lay down? I'm going to listen to your heart. Thank you. Aortic, right sternal border, second intercostal space, regular rate and rhythm, and this is where S2 is heard the best. Pulmonic, left sternal border, second intercostal space, regular rate and rhythm. Arps point, third intercostal space, left sternal border, regular rate and rhythm. Tricuspid, fourth intercostal space, left sternal border, regular rate and rhythm. Mitral, fifth intercostal space, mid clavicular point, regular rate and rhythm. And I'm going to go ahead and check the patient's apical pulse while I'm here for 1 minute. Patient's pulse is 92 beats per minute, which falls under the normal range, which is 60 to 100. Now I'm going to listen for any abnormal heart sounds using the bell of the stethoscope. Aortic, no murmurs noted. Pulmonic, no murmurs noted. Arps point, no murmurs noted. Tricuspid, no murmurs noted. Mitral, no murmurs noted. And mitral is where the S1 is heard the best. Okay, now I'm going to go ahead and examine your abdomen. Okay, you can put your hands on the side. I'll start with inspection. The abdomen is flat. There's no abnormal lumps noted or pulsation noted on inspection. Okay, I'm going to go ahead and auscultate your abdomen. I'll start with right lower quadrant. Bowel sounds are normal active in all quadrants of the abdomen. Okay, I'm going to palpate the abdomen. I'll start with the lower right lower quadrant. and then palpate in a zigzag pattern so that I don't miss any parts. There's no abnormal lumps or swellings or pulsation felt. Okay, thank you so much. Now I'm going to make sure the patient has non-skid socks on. I'll make sure that the core light on is I'll bring the core light to the patient. I'll make sure that the side rails are up, and then make sure that the patient is comfortable. Okay, and then I'll document my findings in the patient's electronic record. I'll put the bed to the lowest position. I'll wash my hands, and then thank you so much for letting me take care of you. That's my video. Thank you. Bye.